Critical care nursing. Critical care nursing is the specialty within nursing that deals specifically with human response to life threatening problems. Seven C's of critical care, that is compassion, communications, considerations of patient, relative, and colleagues, and avoidance of conflict, comfort, protection of patient from suffering, carefulness, avoidance of injury, consistency of observations and care, closure, ethics, and withdrawal of treatment. Critical care nurse. A critical care nurse is a licensed professional nurse who is responsible for ensuring that acutely and critically ill patient and their families receives optimal care. Critical care unit. Critical care unit is a specially designed and equipped facility staffed by skilled personnel to provide effective and safe care of patient with a life-threatening problems that is potentially reversible. So, evaluation of critical care nursing. Critical care units have evolved over the last many decades in response to medical advance. Levels of ICU. Levels of ICU referred to as high dependency resuscitations, short term mechanical ventilations, and simple invasive cardiovascular monitoring for less than 24 hours. Level 2 ICU located in general hospital undertaken more prolonged ventilations provide a high standard of general intensive care including complex multi-system life support. Third level of ICU, that is tertiary referral unit for intensive care patient, provide comprehensive critical care, include complex multi-system life support for an indefinite period, demonstrated commitment to academic educations and research. Roles of Roles and responsibility of critical care nurse: assessing a patient's conditions and planning and implementing patient care plans, provide direct comprehensive bedside care to patient, treating wounds and provide advanced life support, assisting physicians in performing procedures, able to attach equipments on patient as ordered and interpret the data graph on monitor extra. Roles and responsibility of critical care nurse: observing and recording patient vital sign, ensuring that ventilator monitor and other types of medical equipments function properly, administering interventions administering intravenous fluid and medications, collaborating with fellow members of the critical care team, responding to life saving situations using nursing standard and protocols for treatment, acting as a patient advocate, documents appropriately, ensure patient safety, follows the policies and procedure of unit and the institutions, is an expert in nursing knowledge and practice, promotes quality assurance in nursing, providing education and support to patient and families. Principle of critical care nurse, that is anticipatory nursing care, early detections and promote actions, expertise, supportive care, communications, collaborative practice, preservations of patients, physiological defense, prevention of infections, crisis interventions, stress reductions, ethical principles. So these all things it will be there for principle of critical care nurse. Principle of critical care nursing. that is anticipatory nursing care. We have to always encourage and motivate the patient towards his better health care, early detections and prompt actions, expertise, supportive care, communications, collaborative practice, and preservations of patient's physiological defense. Here we have to manage of the patient threat and stress towards his health conditions, prevention of infections, crisis interventions, stress reductions, ethical principles. Organizational model of ICU, that is open models, allow many defense members of medical staff to manage patient in the ICU. Closed model is limited to ICU certified physicians, intensivist managing the care of all patients. Another is hybrid models, which combines aspects of open and closed models by staffing the ICU with an attending physicians and or team to work in association with primary physician. Staffing staffing medical staff including an ICU director, intensivist with sufficient experience to provide for patient care, administrations, teaching, research, audits, extra. Trained nursing staff, that is 1 is to 1 for ventilated patient and 1 is to 2 for other patient. Nurses in charge with ICU qualifications, allied health and ancillary staff, respiratory services, physiotherapists, dietitians, biomedical engineer, technicians, computer programmers, social worker, counselor, housekeeping staff, extra. This is the ICU equipments, that is ventilator, defibrillator, ECG monitor, pulse oximeter, extra. Organizations or design of ICU. This is the one example how to design the ICU. Organizations of ICU, it requires intelligent planning. One must keep the need of the hospital and its location. One ICU may not cater to all needs. An institute may plan beds into multiple units under separate management by single discipline specialists such as medical ICU, surgical ICU, CCU, burn ICU, trauma ICU, extra. The number of ICU beds in the hospital range from 2 to 20% of the total number of hospital beds. ICUs with fewer than the recommended number of beds are not cost effective and excess beds are unmanageable. 10% of total ICU beds are allotted towards isolation room. Each intensive care unit should be geographically distinct area within the hospital with controlled access. No through traffic to other department should occur. Supply and professional traffic should be separated room public visitor traffic. Organization of ICU location should be chosen so that the unit is adjacent to or within direct elevator travel to the to and from the care units and radiological department. Corridor, lifts, organizations of ICU. It requires intelligent planning. One must keep the need of the hospital and its isolation. One ICU may not cater to all needs. An institute may plan bed into multiple units under separate management by single discipline specialists such as medical ICU, surgical ICU, CCU, burn ICU, trauma ICU, extra. The number of ICU beds in hospital range from 2 to 20% of the total number of hospital beds. ICU with fewer than the recommended number of beds are not cost effective and excess beds are unmanageable. 10% of total ICU beds are allotted towards isolation room. Each intensive care unit should be geographical distinct area within the hospital with controlled access. No through traffic to other departments should occur. Supply and professional traffic should be separated from public or visitor traffic. Or organization of ICU, that is location, should be chosen so that the unit is adjacent to or within direct elevator travel to and from the emergency department, operating room, intermediate care unit, and radiological department. Corridors, lift, and ramp should be spacious enough to provide easy movement of bed, trolley, or critically sick patient. Bed space 150 to 200 square feet area per open bed with 8 feet between beds. So 225 to 250 square feet area per bed if a single room bed should be adjustable with side rails and wheels. No head board should be there. So this is the area where the patient care we have to give. Isolation room, that is 250 square feet. Patient areas, 3 oxygen outlet, 3 suction outlet, that is gastric, tracheal, and underwater seal, 2 compressed air outlet, and 16 power outlet per bed. Bedside storage, hand rinse solution, equipment shelf on head end. Storage must be provided for each patient personal belonging, patient care supplies, linen and toiletries, locking drawers and cabinets must be used if syringe and pharmaceuticals are stored at the bedside. Hook and devices to hang infusions, blood bags extended from the ceiling with sliding rails to position. Patient areas, multi channel invasive monitors, ventilator, infusions, pumps, portable x ray unit, fluid and bed warmers, portable light, defibrillator, anesthesia machine, and difficulty airway management equipments are necessary. A cardiac arrest emergency alarm button must be present at every bedside within the ICU. The alarm should automatically sound in the hospital, telecommunications center, central nursing stations, ICU conference room, staff lounge, and any of any on-call rooms. Therapeutic elements in ICU environment, that is window and art that provides natural views,